So assalamu alaikum to everybody. Good evening, good morning, good afternoon, wherever you all are joining us from. We welcome you to the Health and You Community Wellness Series. I am Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health. So just for those of you who may be joining us for the first time in the series, the overall goal of the series is really to create community awareness about health and disease. And the ultimate objective of the series is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. Just some housekeeping rules. Your cameras and microphones have been turned off. Please use the Q&A feature to type any questions or comments. The chat is also opened. You can put your questions, comments on that, and the panelists will receive those. Questions we will address at the end of the session. And again, just a reminder, this is not a CME CPD activity, so no certificates of attendance will be issued. So as you all know, today our session is titled, very exciting talk, Diet, What You Need to Know. And the session will really just discuss and focus on what a healthy diet means and emerging views on popular topics such as vegetarianism, low-carb diets, weight management, supplements, and specific nutrients. I know it's my favorite topic, as I think for many of you who are attending. It is my honor and privilege to introduce our guest speaker, Dr. Ravinder Mamtani. So Dr. Mamtani is a professor of population health sciences. He is also a professor of medicine, Center for Global Health, and our vice dean for population health and lifestyle medicine at Weill Cornell Medicine in Qatar. He is also a professor of community and family medicine, adjunct at New York Medical College, Valhalla, New York. Prior to joining Weill Cornell Medicine in 2007, Dr. Mamtani was a professor of clinical community and preventive medicine and associate professor of clinical medicine at New York Medical College. He was also a physician in complementary and preventive medicine and occupational medicine at Westchester Medical Center in Valhalla, New York. He has many, many years of clinical experience using lifestyle and preventive medicine to treat chronic diseases such as obesity, dyslipidemia, chronic pain, arthritis, mental health conditions, and gastrointestinal problems. He has published in peer-reviewed journals and written a monthly column for a local newspaper in New York on contemporary health issues. Dr. Mamtani serves or has served on many government, hospital, and medical school committees in the US and in Qatar. He is a diplomat of the American Board of Preventive Medicine in the specialties of preventive medicine and occupational medicine, and he is US board certified in lifestyle medicine and integrative medicine. Dr. Mamtani, thank you so much for joining us and really looking forward to your talk today. Over to you.
So good evening and salam alaikum to everyone. And once again, Dr. Chima, thank you for that very nice introduction. I appreciate it. And I want to thank everyone for taking the time to be with us this evening. So what I plan to do in the next 35-40 minutes is to talk about three things. I will make an attempt to define and perhaps say what a healthy diet is. And then I will probably discuss some commonly used diets, vegetarian, weight loss, low carbs, and maybe share my thoughts with you on supplements and other issues, and you will see that in a few minutes. And then I'll wrap up with some of my personal final thoughts. So that's what I plan to do, and I'm looking forward to this discussion. But let me set the stage for this discussion on diet. I mean, I'm sure that we've all gone through experiences with our loved ones or with our relatives in terms of the pain and suffering and diseases we suffer from. And I'm sure all families have gone through one or many of these issues: heart disease, hypertension, diabetes, obesity, cancer, infections, COVID-19. Almost every family has been affected, chronic pain, arthritic conditions, mental health conditions, GI problems, and so on and so forth. And I think that we understand what these diseases mean, and we also understand the pain and suffering that they have caused to us and our families or to people around the world. There are two important things of this discussion. And I would say that based on scientific literature, what we are aware of two important things as I lay the stage. One is that these illnesses kill many people prematurely, where a person should be dying at a certain life expectancy of 85, 80, or 90, many are dying early, which should not be happening. And number two, we recognize based on science that many of these illnesses are clearly linked to unhealthy lifestyles, unhealthy diet, physical inactivity, and perhaps many other factors related to our unhealthy social and physical environment. So if you keep that in context and keep that in mind as I take you through my next slide, which I think makes a very important point, that we know that negative health outcomes are related to a variety of diseases, but these are the ones that are of concern to us. Heart disease, hypertension, diabetes, cancer, obesity, weight gain, pain, arthritis, depression, as I said. But if you look at the chronology of events, before we get to these negative outcomes, the science on disease paradigm tells us that we as Homo sapiens experience some of the other disturbing things that are beginning to happen in the body before we see these outcomes. And they may include all of them or some of them, such as weight gain, stress, fluctuating levels of cholesterol, lipids, glucose, ongoing stress, and so on and so forth. Well, let's go back a little bit further in chronology. Let's go back maybe years before these things begin to happen. And they have to do with the kind of lifestyles that we all deal with. Specifically, many of us engage in unhealthy dietary patterns, physical inactivity. People engage in smoking and use of other harmful substances, stress. Maybe it's the beginning leading to ongoing stress, which takes you to the next stage. Poor sleep, relationships. Oftentimes, we in our medical care environment do not talk about the relationships. And I think we are beginning to find out more that having healthy relationships with our loved ones, with our family, with our spouses is extremely important in promoting health. Now, to that, I will add this part in the whole equation, which is what we call as inflammation. I won't go to the details, but we are constantly bombarded by all kinds of germs, chemicals, foreign substances, which bring about a cascade of reaction in our body. Now, acute inflammation, which is a process that happens as a result of this, subsides, and we are back to being normal. The problem occurs when these unhealthy lifestyles provoke kind of an immune response of bodies such that it becomes long-standing and chronic. That's when the science is telling us that that inflammation is harmful and can lead to occurrence of some of these problems that you're seeing on this slide. All right, so if I had to simplify this, I would say that when you combine unhealthy lifestyles, of which diet is an important aspect, oftentimes being driven by irresponsible behavior, coupled with unhealthy social and physical environment, results in these negative outcomes, which is premature death, early death, pain, suffering, diseases, and so on and so forth. Now, just to put things in perspective, my discussion is about diet today. So I'm going to focus on diet. It is clear that unhealthy diet plays a significant role in causation of early death in human beings. And I think if you were to combine unhealthy diet with two other lifestyle factors, namely lack of physical inactivity and smoking, you're looking at 80% of premature mortality attributed to these three factors. And I think rightly so. I was actually very pleasantly surprised when US government for the first time in 2010, that even though we say people die because of heart condition, cancer, hypertension, what have you, the point that the US government made and other high-income nations, middle-income nations have made the same point, that even though they are the so-called killers, those really are the negative outcomes of things having gone wrong. And they made the point that the real killers are not quite heart disease, cancer, but rather environmental behavior and nutrition factors. And of course, diet being one important component of that equation. Now, if I had to share with you evidence, the time is short, but it's suffice to say for the moment that the use of healthy diet, and I'll talk about that in a few minutes, can actually prevent 11 million of premature deaths occurring worldwide. Just close your eyes and think about this 11 million number. That to me is humongous. It is not an option for us to ignore the kind of food we eat. So that then obviously raises an important question. How well are we handling this? And this was a beautiful write-up not too long ago, and a lot of citations you will see actually are all recent. This is British Medical Journal, and it's a quote from a writer, from a scientist who was also a general practitioner, in the way we are handling all these things. And the quote is, I will read this with you, that medical education, which is, I went to a medical school, received medical education, has focused on being the ambulance at the bottom of the cliff rather than fence at the top. And our medical environment, our healthcare environment, which is the way we see our patients, is still set up like this. Money talks, and there's very little money in promoting eating broccoli or any other vegetarian food and going for a walk, despite them being much more effective. And I think it says it all. It's the way we have structured our healthcare environment and our medical education system. And I think there is something wrong with it. And based on the evidence, the data that I've shared with you, we are not responding to the needs we have in terms of our healthcare problems that we are encountering. Well, and I'm sorry, the future doesn't look good. If things were to continue to progress the way they are progressing, here are some data from high-income nations in Europe as an illustration of that disease paradigm that I shared with you, showing you projection of obesity and overweight. Look at these countries, all high-income, well-equipped nations, a lot of money going into healthcare, US, England, Canada, Spain, France. What is happening to the obesity rates? This is from peer-reviewed literature. This rate is not plateauing, it's not stopping where. It continues to climb. And these are projections, as you can see, 2030. If you go to 2040 and 2045, maybe there might be some plateauing, but it is worrisome. This projection in the years ahead, next 15 to 20 years, is of serious concern to us. And if this is true, as one of this news item from Yahoo said, if this is true, and again, even though we're talking about Americans here, but this could apply to many other countries, including middle-income nations, such as India, which is where I'm from, that you will see a large percentage of people becoming obese and overweight by 2048. Folks, when I look at the data as a physician, it worries me. And here's another example of concern, diabetes. Again, growing by leaps and bounds. Look at this. This is MENA, which is where we are in Qatar, will increase by 110% by the year 2045. Look what's going to happen to Southeast Asia, India included in that, many of the neighboring countries, Pakistan, Bangladesh, an increase of 84%. And look what's going to happen in Africa, 156% increase. How can we look at this data and not pay attention to it? I know we've done well. We've done extremely well insofar as hospital care is concerned. Fantastic hospitals in the US, in Qatar, in India, or other nations. Fantastic. That obviously brings me back to the focus of the topic that I'm engaging in. which is diet. And what do we mean by a healthy diet? Honestly, people asked me 5, 6 years ago, 10 years, I wasn't able to coherently say what a healthy diet means. And it wasn't just me, many other people around the world. But what is a healthy diet? So before I get into this discussion, let me make 3 important points. Regarding a healthy diet, the truth is as follows. Remember, I'm focusing my discussion only on a healthy diet, but I'll make a couple of other points in a few minutes. That there is no one specific healthy diet. It's not as though a physician will tell you, Mr. or Mrs. Patient, or a nutritionist, that this is what you should follow, and it's one standard diet available to all people and will take care of you. That is not the case. Because with nutrition and diet, one size fits all approach does not work. I've seen it in my practice. Physicians have seen it. People around the world have seen it. That's number one. That being said, there is science of healthy diet, but there are also many opinions regarding what constitutes a healthy diet. That's because experts don't agree on it. There is no consensus, if you will, which is why there is ample confusion, as may be reflected in stories that we read in magazines, newspapers, and so on and so forth. So there is no one specific healthy diet. There is science behind it. And that leads me to my third point, that there are some guidelines. And the issue for us is, how do we use those guidelines or adopt healthy diet approach based on those evidence-based guidelines that we see in the literature? So let's talk about those guidelines. That being said, no one healthy diet, there are scientific guidelines, and the question really is, how does one, you and me, use these guidelines such that they work to our advantage, knowing full well that we come from different backgrounds, from different countries, different resources, more money, less money, and so on and so forth. So here are those guidelines. Of course, most human beings rely on a diet of 15 to 2,800 calories. Of course, this could change. I'm just giving you a range. Depends on your physical activity, what you do on a day-to-day basis, with a reasonable distribution of the macronutrients, essentially carbs, fats, and proteins. And here are some distributions. And again, these are ranges: more carbs, less fat, and less protein. About 20 to 35% of fat and maybe 20% of protein. A healthy diet is also the one that we should be able to afford and easy to follow. We shouldn't have to go crazy cooking that diet. And that's what a healthy diet is. You have to conform to what you have at home, your resources, and cook and make a healthy meal for yourself. And such a diet should allow you to follow a habitual pattern. It's not about eating healthy diet one day a week or once a month. You must, in order for you to engage in healthy practice, this should become your habit, if you will, day in and day out. And such a diet should be balanced in terms of carbs, fats, proteins, but also vitamins, minerals, and so on and so forth. You will see this. I will keep using the word plant-based. And I'm telling you, the research is so strong that people who subsist on plant-based diet, I'm saying plant-based, not only plant, do extremely well. And such a diet should be low in processed foods. The less you process, the better off you are. Certainly low in saturated fat, sodium, soda beverages, which are giving you extra calories, and also moderate in low-fat dairy products. The research is absolutely as crystal as it can be that people who subsist on such a diet, following those principles, have a lower risk of heart disease, diabetes, cancer, and many other chronic conditions. Now, if there is one takeaway message from this discussion, and this is a beautiful illustration that comes from US dietary guidelines that was published about 10 years ago, and that appears on the USDA web link, that if I had to walk away from a dining table when I'm eating food, if your plate looks like this, half of your plate should be full of fruits and vegetables, maybe another 25-30% with grains and little dairy, and 20-25% with protein. I'll talk about that in details in a minute or two. you have met the requirements. This visual impression of what your plate has in it is a fantastic guide in terms of what we should be eating on a daily basis. Now, here are some more specifics about those guidelines that I want to share with you. One is, as I said, it's the eating pattern. Your habitual pattern of eating should be healthy. We should be eating in moderate portions. There should be variety. There should be plant-based foods. The more colorful your vegetables are, the more healthy your food is. There should be proteins in it, most of them coming from plant sources. Certainly, I'm not against chicken, but certainly poultry, chicken can add to it. But also there are other good things that you see as sources of proteins: nuts, seeds, soya products, seafood, certainly fishes encouraged, and lean meats. Whole grains. I want to spend half a minute on whole grain. When you look at the grain, this is 50% of a food, of calories come from grain. Here is the grain that I'm talking about. This is not too scientific, easy to understand. A grain has three components to it. There's the outer germ, or also called bran. There is the inner germ, called germ. And then there is the white part, the endosperm. In grinding your grain or subjecting it to all kinds of processes, if you're taking out the outer portion and the germ, you are left with this white part, which is the white flour. Not good. As you can see, brain contains vitamins, minerals, and so does the germ. So it is best not to process. It's best to eat any bread, any roti, chapati, or any kind of bread must contain whole grain. If there is one thing you want to do, when you buy a loaf of bread next time or you eat anything, it must say whole grain bread, whole grain flour, whole wheat. A bread being brown is not sufficient to call it a healthy bread. Who knows what they've added to it? It's a preservative, it's a color. If bread says multi-grain, it's no good unless I see the word whole grains in it. I'm looking for that word whole. And I would submit to you that at least in future, if you're looking for bread or any other similar kinds of source of carb, look for the word whole on the labels. Fat-free or low-fat dairy products, emphasis on unsaturated fat. We are moving away from saturated fat and replace your saturated fat with things such as olive oil, canola oil, seeds, avocados, and so on and so forth. Limiting saturated fat is essential. Saturated fats in excess quantity is bad, and so is trans fat. And then, of course, trans fat has been introduced. They were introduced into the US market, and they've been introduced all over the world, because what they do is they add shelf life, where a grocery person must sell certain product within 2-3 days. Well, and if it contains trans fat, you can increase the shelf life so they can remain on the shelf for a week or 2 weeks. But science is clear on consumption of trans fat, that they are absolutely can be dangerous and can cause serious problems. Limiting sodium is extremely important. Limiting added sugars to your food or extra beverages in terms of sodas and so on and so forth. None of that is good. Wholesomeness in nutrition diet is important. I always say that vitamin C from orange is a better option than vitamin C coming from a pill. Because in eating an orange, you're also eating fiber, perhaps many of them, thousands of phytonutrients, which are beneficial that have not been identified. And the one point that I will make now, and will make it toward the end, is that there is synergism between diet and other lifestyle factors, such as good sleep, physical activity, relationships, and having a stress-free environment. They all work together in giving you synergy so that the outcomes are wonderful. So having laid that foundation and spoken about the value of a healthy diet, let's look at some examples. But before I get into the examples, I was doing research and trying to look at the various types of diet. I've done a lot of clinical work in nutrition. I've done obesity management. I used to advise a lot of patients in New York. And I think if you look at the types of diets, the more I read about them, the more questions come to mind about their definitions, their features, their characteristics, benefits, surrounded by leading to confusion and ambiguities. I'm telling you, it is real. Just think about the recommendations on eggs. Eggs used to be healthy, and they said, no, they're not good. It's cholesterol. Back to again being healthy. If you look at the history of consumption of eggs and their value, now we are where I think we understand, who knows what's going to happen tomorrow, that a consumption of perhaps 1 egg a day is good. Anywhere between 4 to 5 eggs and 7 eggs a week is good. But based on science, we know. Okay, I can only share with you what we knew at the time. And then I went on to classify. I said, when I'm talking, let me see if I can classify diets. And I saw these are just prominent categories of these diets: belief-based, weight-controlled, crash diets, detox, diets of medical conditions specific, name them: keto, elimination, gluten-free, vegetarian diets, fat diets, specific diets, many other, and of course, put commercial diets right in the middle. There's a name given to every diet that a company may produce. They think the benefits, so-called benefits that people might see, are related to their name and company, and not so. And I can talk about that at another time. I went and actually counted the number of diets. There are more than 300 named diets. People often ask me, so Ravi, what do you think about this diet? No, I don't know. They tell me, what does it contain? And that's the reason why I'm having this discussion. I think it's the principles that you need to follow in order to come up with a diet that's good for you. So next 15 minutes, let's look at some prominent diets. I won't go to the details, of course, but I want to share with you what we know, because there are a lot of questions being asked about these low-carb diets, low-fat diets, vegetarian diets, Mediterranean specific diets, and so on and so forth. And I'll see if I can answer some questions toward the end. Role of coffee, chocolate, olive, I don't know, multivitamins, we'll see how things go. So a low-carb diet is anything which contains or calories coming to the extent of no more than 45% from the diet. Remember how I said there was a range about 50, 60, 65%, but once you drop to a level of less than 45% of calories coming from carbs, we classify that as a low-carb diet. But of course, there are many diets that are notoriously low-carb diets, 5%, 10%, Atkins, keto, and I'll come to that in a second, because keto's a diet that people ask me a lot of questions on. They all aim at weight loss. They all aim at weight loss. There have been reported benefits of certain improvement in cholesterol levels and so on and so forth. However, folks, colleagues, there is no long-term benefit that has been established for low-carb diets. They may initiate a change, then for us to capitalize on that change, maybe as far as you can go. But if you're looking for a long-term benefit, we know of no such long-term benefit, at least based on my reading. Keto diet has been talked a lot about. It's typically a low-carb diet, high in fat, and people subsist on these kind of diets. And the principle is that when you go on such a diet, the body produces what are known as ketones. They come from liver, and then you go into your fatty stores, and you may end up losing weight. Benefit? Well, their role in epilepsy has been described before, but we don't do that. Their role has been discussed in short-term weight loss. Maybe there's some value to it. However, remember, they can present risks because they're high in fats. We don't know what happens to human bodies if you're on this low-carb diet for months and years. And because the consumption of vegetables is low, you're probably depriving yourself of essential nutrients that may come from vegetarian sources. Now, some benefit in terms of short-term weight loss, perhaps. However, can be heavy on red meat and other fatty substances. And I am not aware of any long-term health benefits of keto diet, so I worry about it. If somebody is using a low-carb diet to initiate a change, maybe, okay, but this is something that's not a proven value in the long term. What about low-fat diets? A lot of discussion on it. People have compared. I will make one point show you a couple of slides on where people have compared low-fat diet with low-carb diet on weight loss. Let's not worry about the minute prints on this, but I will look at this. This is the Journal of American Medical Association from 2018. I'm sharing with you all recent data appearing in prestigious journals worldwide because there is so much discussion on diet, weight loss, and so on and so forth. One thing that became clear in these two publications that I'm going to show you is that if the diet is healthy, it doesn't matter whether it's a low carb or a low fat diet. This is one study that showed that on weight loss, no difference between a healthy low carb and a healthy low fat diet. Another story from JAMA, 2020. These are prestigious journals. They looked at the mortality difference between low carb and low fat diet. None, they're comparable. Both reduced mortality essentially because they were healthy diet, folks. So getting yourself hung on to a low carb or low fat is a moot point, I think. If your diet is healthy, you will get the benefit. So my take-home message, what matters is a healthy diet, high quality carbs with fibers, unrefined, not refined, not that white, plant proteins, unsaturated fats, regardless of whether it is low carb or low fat, doesn't matter. That diet must be healthy. Vegetarian diets. I didn't know that these individuals were vegetarians, some of the famous people that we've seen. Science is very clear, very clear. People who subsist on plant-based, I'm talking about plant-based, not only plant diets, not vegans, they enjoy fantastic health outcomes, lower mortality, lower incidence of these chronic conditions, and here are references supported by science, all clear. However, people have raised concerns about vegetarian diets, more so vegan. No vitamin B12 in it, which is true. A pure vegetarian substance has no vitamin B12 in it. They are low on calcium, vitamin D, iron, and omega-3, which are all helpful. They're of concern. But here is the punchline. If you plan your vegetarian diets well and bring in fortified stuff in it, and they are of vegetarian sources, could be dairy products and so on and so forth. I'm not talking about pure vegan diet. I'm talking of a predominantly vegetarian diet in which you can bring in other things. To me, on this planet, it is probably the most healthy diet. And I'll share more information with you on that, just to make that point. Mediterranean diet has been talked about at length. This is what it looks like. A lot of research on it. It contains, again, whole grains, vegetables, emphasis on olive oil, nuts, seeds. It's minimally processed, less sugar. But that being said, again, like with any diet, there is no one Mediterranean diet. There are patterns to it. But the evidence for Mediterranean diet is very, very strong, folks, very strong. And again, partly because it follows a similar pattern that I shared with you in terms of the guidelines earlier. On heart disease, I don't have to go into the science, basically making a point. This was a study that was published in New England Journal of Medicine. When they say that if you see something in New England Journal of Medicine, it's unquestionably real science with a lot of truth in it. And in this, they compared people who were on vegetarian diets looking at endpoints, complications of cardiovascular diseases. This is a little, of course, slide with statistics in it. But people who were on a controlled diet as compared to these Mediterranean controlled diet did poorly in terms of mortality. People on a Mediterranean diet did extremely well. Clearly, MD is associated with longevity, reduced risk of cardiovascular illnesses, as well as cancer. The evidence is quite strong. Remember how I talked about the inflammation being a factor that propagates and moves that pyramid and the disease paradigm forward? There are foods which can be anti-inflammation. And here are examples of those foods. Omega oil, which comes from fish, olive oil. And the more colorful your vegetables are, the better it is. Whole grain, plant proteins, and certainly many spices that many of us eat here in the Middle East, in the Indian subcontinent. Stick to them. They do wonderful things. And in terms of specific diseases to which you respond in terms of these substances, these kind of anti-inflammatory foods include heart disease, diabetes, cancer, rheumatoid, dementia, certain skin conditions, and here are some of the substances, nutrients that are helpful in those situations. So based on what I've said so far and these diets that I've discussed, I'm going to ask the question, obviously, if they all have the value to them, is there anything common in them? You bet. And this is where we've been actually flabbergasted. We understand this more now than we ever did. The diets, Mediterranean diet was an example of this. Any diet that relies on whole grains, legumes, that is beans and so on and so forth, plant proteins, and with some maybe fish, low in processed meats, low in red meat, and low on refined carbohydrates, not good, white bread, maida, not good, and added sugars, will do extremely well, will have a lower rate of mortality, enjoy longevity, and also these individuals enjoy better metabolic parameters. I'm often asked a question about should we be buying, and I used to get confused, should I buy when I go, there's olive oil, a lot of emphasis on olive oil and on canola because they're healthy fats. What kind of oil should I be buying on? There are two commonly types of oils available. There's the either extra virgin oil, which is fresh, comes directly from olives, and then there's the regular olive oil. The difference, however, is the regular olive oil can be used for cooking. You can subject it to higher temperatures because it's gone through certain processes. Extra virgin oil, which contains millions of nice nutrients and phytonutrients, cannot be subjected to high temperature. Don't buy extra, it's very expensive. Don't buy extra virgin oil only to take it home and cook it because you're deactivating that oil. You're wasting your money, you're not putting it to good use. They can only go in salads. You must consume this oil the way it comes, but extremely healthy. Regular olive oil, which is expensive, can be cooked. Canola is another option available to you. I'm asked questions on, Ravi, your views on chocolate, coffee, and I'll maybe give you a 2-minute thing on it. Dark chocolate is good because there have been studies that have shown that anything that contains 70% of cocoa, when you buy chocolate, look at it, darker the chocolate, the better it is because it contains phytonutrients, antioxidants, and actually, if you will, I don't want to say this, but if you're looking at a dose per day of dark chocolate, that could be helpful. It's about close to 25 to 30 grams of dark chocolate a day. Coffee is a good thing because there are plenty of studies that have supported coffee because of the antioxidant properties of coffee, which is anti-inflammation, protecting you from cancer and so on and so forth. But you cannot exceed 3 to 4 cups a day because this excessive consumption of coffee can give you other problems, anxiety, systoles in your heart, and so on and so forth. So keep that in mind. If there is one food that I find is fantastic, I didn't know of this up until 3-4 years ago, is quinoa. Quinoa is one food that I've learned about a lot in recent days. It has no cholesterol in it. It has no gluten in it, but more importantly, it contains all essential amino acids. It's a complete protein, as the protein you may find in red meat, but doesn't have the fat that goes with the meat, the quality of protein in the meat with fat. This is minus that. It is beneficial. I would encourage for people to consider eating quinoa. It is slightly more expensive, but you get all kinds of things, and I would encourage you to look at it. I'm often asked about the role. It's nothing to do with diet. Should I be engaging? Should I take multivitamin tablet a day? Well, if you're doing healthy dietary practices the way I've shared with you, for a person who's healthy, who has no problems, and is young, you don't need to take multivitamin. However, as many of us are, if you engage in erratic eating behaviors, as I do, you go to work, you're not able to get a decent meal. Or if you, let's say, an elderly person who's on 2 or 3 medications, or in individuals in which there may be impairment of all nutrients, or people are not happy that they're eating right kind of food, having a multivitamin tablet 1 a day is not a bad idea. But the reason for that is you're supplementing your diet. You're using multivitamin as a supplement. It's not as though the more the merrier with multivitamins. Excessive dose of multivitamins can be dangerous and can create a lot of problems. To the extent it serves as a supplement, in addition to whatever you're eating, in doses that cannot go beyond certain range, it might be okay. Or do it once every other day. But we're talking about multivitamins as supplements in low doses, not in excessive quantities. All right. So a healthy diet, when coupled with other healthy lifestyles, can have very powerful, beneficial health outcomes, particularly on diseases that you see here. They promote longevity and improve quality of life. And I tell you, when you bring these things together, wonderful things can happen. And this was a study that was published not too long ago by Dean Ornish. You've heard of him. I share with you this study because this was the first study that opened eyes of many people around the world, okay, including doctors. Dean Ornish, for the first time, was able to show that you can actually reverse heart disease if you combine a healthy diet with some of these other lifestyle approaches and basically reverse it. This is what he found in a study that received a lot of attention, published in JAMA in 1998, 22 years ago. And subsequently, there have been umpteen studies document the same thing. What he showed, and I'll keep it simple, that this was the group, he divided them into 2 groups. People were receiving cardiac care by doctors with medications. And this was the group that was put on these things that I shared with you, vegetarian diet and these lifestyle factors. What did he see 5 years later? The lumen of the coronary arteries opened up. Complications were fewer. These people who are on control group receiving care from top-notch doctors, the condition actually worsened. You know, people had difficulty understanding. I share with you because this was the major study that really launched additional studies, which all have proven that there is role for this kind of approach. Now, I will share with you a 2-minute video, and then I'll stop and be glad to take any questions. This is an interview between President Clinton and Sanjay Gupta, the famous CNN correspondent, that happened a few years ago, but there are some very valuable suggestions in here. So stay with us.
They confirmed the determination that I had serious blockage and needed the surgeries.
The 58-year-old Clinton needed to have his chest opened, his heart stopped, and surgery performed. On Labor Day in 2004, Mr. Clinton had 4 blood vessels bypassed. That's the test I'm having done. We can now find clues before heart trouble gets dangerous, even before the first symptoms. As president, Bill Clinton never got any of the advanced imaging, like the coronary calcium scan or the ultrasound of his carotid. Those are tests that are now more readily available to everyone. But President Clinton's heart troubles were not over. When the devastating earthquake struck Haiti in 2010, President Clinton flew to Port-au-Prince to support the relief efforts. I spent time with him and saw that he looked tired, not himself. The doctor said it was a mechanical failure of the bypass, and he needed stents to open the blocked artery.
The goal of the treatment, and I think it will be achieved, is for President Clinton to resume his very active lifestyle. This was not a result of either his lifestyle or his diet, which have been excellent.
But Dr. Dean Ornish didn't see it that way.
And so I wrote him a letter and I said, you know, the friends that mean the most to me are the ones that tell me what I need to hear, not necessarily what I want to hear. And you need to know that your genes are not your fate. And I say this not to blame you, but to empower you. And I'm happy to work with you to whatever extent you want to move forward in that way. And we met a few days later and he said he was ready to do it.
This time around, he decided to get much more strict in his approach. No more meat, no more eggs, no more dairy, almost no oil. The mantra is, eat nothing that has a mother or a face. Clinton's dietary guides, Dean Ornish, and this guy, Caldwell Esselstyn, at the Cleveland Clinic. Every month, the 77-year-old Esselstyn holds a day-long seminar, attracting doctors and heart patients from across the country, like Sharon Kintz, a retired private investigator from Canton, Ohio. Kintz had a heart attack 6 months earlier after a coronary artery became completely blocked. What Kintz did next may surprise you. She turned the surgeon down cold, said no to open heart surgery, and decided to take a chance using food as medicine. Like President Clinton, Kintz has given up the food she loves, like butter and cheese. She's betting her life on Dr. Esselstyn's diet.
She had a heart attack.
Oh, yeah, I know.
You know Sharon.
Oh, yeah.
Doctors recommended she have an intervention. She's not doing it. Is there a downside? Could she be putting herself at risk?
No. I think that's an excellent question. In hundreds of patients, data now going back over 20 years, and this most recent study about a decade, once they start eating this way, you will make yourself heart attack proof. Going back over
proof.
We know that if people are eating this way, they are not going to have a heart attack.
Esselstyn thinks heart disease is completely preventable, no matter what sort of family history you have, simply by eating right. During his research, he came upon a stunning fact. Some cultures around the world, like people living in Central Africa, Papua New Guinea Highlanders, and Tarahumara Indians in Mexico, have virtually no heart disease.
We know what they shouldn't eat. That is oil, dairy, meat, fish, and chicken. What do we want them to eat? We want them to eat all those whole grains for their cereal, bread, and pasta, beans, vegetables, yellow, red, green, and fruit.
I was curious about the science behind Dr. Esselstyn's claims, so I dug up some of these peer-reviewed journals. They're small, just a handful of patients, but the results are pretty impressive. In one study here, patients on the Esselstyn diet and cholesterol-lowering medication had no heart attacks, had no coronary events of any sort after 5 years. And 3/4 of these patients actually saw their blockages get smaller.
You're not talking about just reducing your chance of heart disease. You're talking about potentially reversing heart disease.
Oh, absolutely.
The late wisdom is that once you develop these plaques, they're there. You're stuck with them. Try not to let them get worse. Is that faulty thinking?
I think it's absolutely faulty thinking.
Here's a picture Esselstyn likes to show of a heart patient with a blocked coronary artery. And here's that same patient after going on a plant-based diet. You see the way the blockage has almost disappeared? Kintz is a true believer. So is former President Bill Clinton. And nowadays, they have a lot of high-powered company. All of these CEOs and former CEOs are either vegetarians or vegans.
Would you call yourself healthy now?
Well, I think I'm healthier than I was. You know, I lost 20-something pounds. All my blood tests are good. All my vital signs are good. And I feel good. And I actually have, believe it or not, more energy. I seem to need less sleep. I don't think there's any question that not only could we be past our last heart attack, but the vast majority of people, even my age, could actually reverse a lot of their blockage.
Heart disease could be as rare as malaria today if we simply put into practice what we already know.
it is possible to keep everybody from having a heart attack with education, with knowledge, with information. Now the question becomes, are people going to do this?
I hope I've given you some food for thought today, and if all this makes you want to overhaul your diet, especially if you're a heart patient, you should talk to your doctor.
So a couple of final thoughts, and I'll wrap up. A couple of, I think, thoughts that I think should stay with us. And I tell my patients, my loved ones, everyone I talk to, as an example, when you're walking away from the table, dining table, make sure your plate looks something like this. Half of it is fruits and vegetables. If there's nothing else from today's discussion, my feeling is that this suggestion should be helpful to all of us. Probably 1/4 of grains, emphasize on whole grains, and protein, mainly from plants, but certainly bring in fish, chicken, if you will. 3 simple rules of eating, in words of Michael Pollan, a famous American journalist who is a specialist in farming, in nutrition, and so on and so forth. 1, eat food, of course, in moderation, not too much, mostly plants. And I'll leave you with 2 final thoughts. If you had to characterize a healthy diet, it can be found in these words, and I've done the best I could: moderation, variety, wholesomeness, plant-based, healthy pattern is important, and a reasonable balance of macro and micronutrients. Diet is important, but let's not forget, so are physical activity, managing stress, social relationships, sleep, and staying away from harmful substances. So with that, I want to thank you for listening to me, and I'll be glad to take any questions and comments that there might be.